It's great to have economist Gerald Friedman, professor of economics at my alma mater, the economics department at the University of Massachusetts, back on the show. Jerry, we've been speaking to you for years about, what would it cost if we went to something like a single payer or Medicare for all healthcare plan system in the United States. We've been talking about the cost of a lot of different social welfare and other plans. And now that Bernie Sanders, as presidential candidate on the Democratic side, has been proposing some of these same ideas, people are going to you and you're explaining, hey, here's what this would cost, here's what that would cost. And this is not without controversy. Now, even some self-described liberal economists are saying Bernie Sanders, Gerald Friedman, these people are understating what the cost is going to be of some of Bernie Sanders' proposals. So let's start sort of at the broadest point. What do you think is behind this disagreement as to your assessments of the cost of these plans?
Well, I think that there is a legitimate intellectual scholarly dispute about how much money could be saved through a universal program and how much extra cost would be incurred. And I'm just going to assume that those who disagree with me are following this legitimate, honest disagreement. The major critic of the Medicare for All program is an economist, Kenneth Thorpe at
Right.
Emory. And Thorpe used to be a strong supporter of single payer. He was kind of me before my time because he proposed financing plans for single payer plans for Massachusetts, for Vermont, and for the entire United States. In about 10 years ago, he did this. And when he did that, he made estimates of the savings that are very consistent with the estimates that I've been doing and draw on the same sources. So, we 10 years ago, we would have agreed. Now he is saying something different. His critique of my funding program for single payer Medicare for All basically has two areas of disagreement. The first is the savings. He assumes much, much less administrative savings from administrative waste than I assume. Basically, he assumes that we would continue to have an administrative burden on our health care that is twice what Canada has. So we would save only less than half of what I anticipate we would be able to save. And I'm not assuming that we would become as efficient as Canada, which has a single payer plan. So I'm already allowing for some waste, some greater waste in the United States. But he's assuming much, much greater waste. When questioned by, I've never spoken to him myself, but when questioned by a reporter, the reporter told me that Thorpe says, well, we couldn't achieve all that administrative savings because in the United States we'd still have to have much more medication review than is done in Canada. It's like, I don't understand why that would be the case, and I don't understand why it would cost as much as he's assuming. The difference is a matter of hundreds of billions of dollars a year. So that's one area. The second area of disagreement, Thorpe assumes that when we do away with copays and deductibles, utilization of healthcare services will soar by about 30%. I'm assuming an increase of 10%. When Canada and Taiwan went to single payer plans in 1971 and 1995, respectively, they had increases in utilization of about 3%. So I'm already factoring in this idea that a lot of Americans are not able to go to the doctor now because of the cost of copays and deductibles. And when we do away with those, there'll be much more utilization of healthcare.
So it's sounding like you don't take issue with the sort of concepts he's bringing up, but you're saying you have accounted for those ideas and those possible increases in costs, and you just don't think that they will be as significant as Mr. Thorpe does.
Exactly. And there's an irony here, because if he really believes that copays and deductibles are keeping that many people from going to the doctor, then I think he would also have to agree that they are killing lots and lots of Americans. Because if people need to go to the doctor and can't because of the $50 copay or $30 copay or $2,000 deductible, then maybe we really need to move to do away with those so that people can go to the doctor when they need to.
Right, that's an interesting
I
idea, right? Which is, on the one hand, we have to balance both sides of the equation. On the one hand, if he believes that the increase in utilization is going to be drastic, if he thinks so many people are not getting care because of the current copays and deductibles associated, we have to assume that there are huge systemic costs to those people eventually ending up in the emergency room or through the much more expensive ways that people ultimately get health care that we know exist in this country. And so that savings also has to be considered in the equation.
That's right. And worse, when people don't get care, they get sicker and they die. I estimate that 200,000 Americans die each year because they cannot afford to go to the doctor when they need to. And that is apart from the 70,000 a year who die because they don't have health insurance. So we've got a real problem here. And I think Thorpe is suggesting that the problem is even much greater than I'm saying. Or else, he's just kind of, putting that assumption in because, whatever. But those are the two major disagreements that we have. And you add them together, and he gets his estimate that Bernie Sanders' plan will cost $1 trillion a year more than I'm projecting, because there'll be less savings and there'll be more costs.
And there's another economist, right? Austin Goolsbee, formerly chairman of President Obama's Council of Economic Advisors, now at the University of Chicago. Let's sort of turn our attention to him a little bit. And his sort of general thing is the numbers don't remotely add up. That's a quote. He's talked about the trillions in spending that these plans would add. Is your sense that, I mean, he's not working for Hillary Clinton to the best of my knowledge currently. Is your sense that some of these critiques, be it Austin Goolsbee or other economists, are they politically motivated in some sense?
I have no idea, and I won't comment. I don't know why they're saying those things. Goolsbee draws on basically one source, which is Thorpe. The only critique of the healthcare plan, and when you're talking about Sanders' spending program,
Yeah.
most of it is healthcare. The healthcare is the big one. We're going to be adding 1.4 trillion to 1.3 trillion dollars in extra federal spending a year. That's just huge. Everything else is much, much smaller. So the healthcare plan is the only one that people have evaluated seriously. And Thorpe is the one who evaluated. And everybody who is criticizing from Hillary Clinton herself on down, everyone who's criticizing Sanders' healthcare plan is drawing on Thorpe. I think Thorpe is wrong. I think he himself used to think different things than he's saying now. Goolsbee's strong on Thorpe. Goolsbee's also just kind of throwing around names, just saying things. Oh, unicorns and puppies and rainbows.
Yeah.
I'll tell you, I have a puppy, and my wife wanted to get him a little unicorn horn and paint a rainbow on him, and send the picture to Austin Goolsbee. But I'd rather keep it from getting too personal.
In your
sure
heart of hearts, is this conversation a pragmatic one, or is it moot in the sense that even if Bernie Sanders is the eventual Democratic nominee, and even if Bernie Sanders is the eventual president of the United States, that Medicare for all will be a practically speaking non-starter? What's your sense of that?
Well, actually, I don't agree.
Okay.
I think that Medicare for all will be enacted, regardless of whether Bernie Sanders wins the primaries tomorrow or wins the presidency. It's the only way that we can control healthcare costs. And it's interesting, if you read Thorpe's little paper, he acknowledges that, because he says that over time, Medicare for all will slow the growth in healthcare spending. Every other country in the world has had slower growth in healthcare spending than we have. And the excess growth in healthcare spending in the United States is entirely because of higher prices for healthcare, because of the waste in our system, from the growing administrative burden and the rising monopoly pricing of drugs and other medical services by monopoly big pharma and big hospitals. The only way to control administrative waste and the only way to control monopoly pricing is through a single payer program. So the only way that will be able to afford healthcare in the future is with a single payer program, and that we're going to come around to that eventually. So I think Senator Sanders' campaign has been a great help for the single payer movement because we're having this dialogue. And Mahatma Gandhi had a phrase that first they ignore you, then they laugh at you, then you win. There may be a couple of the steps in there. We're at I think we've actually moved past the laughing stage, and while Goolsbee himself hasn't backed down from his mockery, the Romas, David and Christy Roma, have seriously engaged me in my analysis of the impact of his program in general, Senator Sanders' program in general. And I really disagree with them. I think they're wrong. They misunderstand the workings of the economy. But we are having a serious discussion about the capacity output growth, about what healthcare will really cost on the different alternatives, about how we can move to single payer. And I think this discussion is going to continue regardless. Senator Sanders' campaign has sparked it, and it will continue regardless of what happens to the senator. And we will adopt single payer.
All right. Well, I love your optimism and, of course, hope you're absolutely right. We've been speaking with Professor of Economics at the University of Massachusetts in Amherst, Massachusetts, Gerald Friedman. Always great to talk to you.
Always a pleasure. Thank you, David.